It looks like we have another question from our viewers. This one is YouTube question from Antoine. Antoine says, I have a neighbor who developed scoliosis later in life, and I want to know what it is and what causes it. So scoliosis is an abnormal condition of the spine in which the spinal canal, the spinal curve, is sort of in this S shape in a frontal plane. And again, it's a rotational problem. Your spine may curve to the right or to the left, and there may be more than one bend. Frequently, we refer to it as a compensatory curve and a structural curve. Structural curve is the one that's there all the time, and the compensatory curve is what allows many of us to keep our head right above the pelvis. It compensates. So from behind, a normal spine appears totally straight, and when there's scoliosis, you can see that there's a bit of a bend, especially when one leans forwards, you can capture a lean to the side. So there are 4 types of scoliosis. The idiopathic scoliosis, that's the most common type. And it's usually diagnosed in someone who is about to become or just became a teenager. As these kids are about to enter the period of life where they grow really quickly, this is what fuels the spine that is predisposed to a bit of a bend to bend further, and a lot of scoliosis progresses during that time. Now, neuromuscular scoliosis sometimes develops in individuals who can't walk due to a problem related to their muscles. These types of curves are very severe, and oftentimes you see kids diagnosed with neuromuscular scoliosis very early in life. Degenerative scoliosis is the most common type in my practice. Now, that's a type of a curve that develops later in life as the discs degenerate asymmetrically. Oftentimes, it begins in the lower back and is frequently associated with back pain as well as significant stiffness. Then there's also congenital scoliosis, and that's a type of scoliosis that we see in little kiddos once they're born. That type of scoliosis oftentimes results in kids needing an operation, and it can result from malformations in vertebra that will reliably cause the curve to progress.